All right, now you can hear me. Well, thank you so much for that introduction, and I fear that I'm not going to get you up on your feet dancing like Miss Amy did, but that's a tough act to follow. But I appreciate you allowing me to come today and hopefully spread a very important message about breast cancer. As was mentioned, I work for Susan G Komen for the Cure at the NC Triangle affiliate in Durham, North Carolina, and we used to be referred to as the Breast Cancer Foundation, but a year ago we changed our name to Susan G Komen for the Cure, so you may recognize the Breast Cancer Foundation. You may also know us for the Race for the Cure, which is our race that we do every June at Meredith College. This year it will be June 14th. For those of you who are not familiar with the Breast Cancer Foundation, we started 25 years ago with our national founder, Nancy Brinker, who promised her dying sister that she would do everything she can to eradicate this disease and not let other women suffer as she did. Her sister Susie died at age 36, and at that time, Nancy started her race and therefore her mission to save lives and end breast cancer forever by empowering people, ensuring quality care, and energizing science to find the cures. Am I doing that? Sorry. Susan G Komen for the Cure is nationally headquartered in Dallas, Texas. We have 125 affiliates across the United States, also to include Puerto Rico, Rome, and Frankfurt. And your local affiliate is here in Durham. And we have a mission to engage the community in educating people in breast health and breast cancer awareness. We bring in money by fundraising, by sponsors and donors, and 25% of those funds go to our national headquarters to fund groundbreaking breast cancer research. At the local level, that 75% stays here in the community to fund local organizations to help provide services for screening, education, treatment support, post-diagnostic service support to the people here in our community. That's 75%. Some of our local organizations, for example, that we provide grant money to is, well, you're enjoying one of the events right now, which is the Blaney Bette Massey Morris Foundation. We provided a small grant to them. These folks go out and educate women in their community about breast cancer awareness, breast health education, and positive habits. We also provide funding to places like Caswell County, who uses a mobile mammography for services that don't exist there because they don't have a mammography unit in their county. They don't even have a hospital. This is a way that we can bring mammography services to women who would have the transportation problems or accessibility problems of getting the care that they need. We also have programs that target the Latina population, and they provide fully comprehensive services from education all the way to post-diagnostic services. So this is just a way that we, an example of how the money that people donate to our organization works in your community. I also wanted to mention to you about volunteer opportunities. We have locally probably about 200 year-round volunteers that help to run this organization. We are fortunate enough to have 5 staff people that work there full-time, but the majority of the activities are run by volunteers. Nationally, it's probably about 750,000 volunteers working towards this mission and to find a cure. That's an amazing number, and it's amazing to see what these volunteers can do because they range from, our president of the board to, running programs, to helping out with the Race for the Cure and handing out bottles of water that day, to going out and speaking as I am now. So we have a wide range of opportunities. You can assist with our grants program. You can help educate, and there's a whole opportunity there. You can actually help bring in more volunteers. So I do recommend, there are some brochures out on the front table. I think here, if you go out, it's on your right. And there's some information there, and I encourage you to pick up that information. They have shower cards that talk about how to do a breast self-exam. They have mammography cards that talk about the importance of mammography and what it's like and how often to go. They also have basic information on breast health facts. And they also have something, it's a bookmark, and it has a pink ribbon on it, So you can actually wear this pink ribbon on your clothing. It has important information on here about our mission and our promise. It also has our local information. So if you are interested in getting involved in donating or just learning more about breast cancer, you can contact us. It has our phone number, our website, and our address. One of the things I want to leave you with today, as I know you guys want to get back to the more exciting part of this program and the music, but I do want to leave you with this. Early detection saves lives, and when diagnosed early and confined to the breast, the 5-year survival rate is 98%. That's used to be 74% about 25 years ago. If that just shows you how hard people like the volunteers at Susan G Komen for the Cure have been working to raise awareness about this awful disease. When detected early and confined to the breast, the 5-year survival rate is 98%. That is an amazing number, and what that means is that, like Dr. Luther said, knowledge is power. It means we need to educate ourselves, we need to educate each other, and I believe everybody in this room has a loved one, a grandmother, mother, sister, a daughter, even if it's a close neighbor, a friend, a coworker, somebody that you care about, somebody that may have been or has already been affected by breast cancer. We need to educate ourselves and be aware. More often, white Caucasian women are diagnosed with breast cancer. But the reality is, more often, African American women actually die from the disease. And part of this reason is because they're diagnosed at a later stage. That's why it's so important that we educate each other and that we learn more about early detection and about the methods, life-saving screenings and methods that you can use. And those methods are to practice your self-breast exam monthly, to get your clinical self-exam or your clinical breast exam, which can be done by your healthcare provider. Get that done annually. And starting at age 40, to get an annual mammogram. Those are Susan G Komen's recommendation, as well as American Cancer Society. You may hear other things in the media, but the important thing is to talk to your doctor about it and see what they recommend. And if you're high risk, they probably recommend you go in earlier. So again, I want to leave you the important message that early detection saves lives. And I want to thank you all for inviting me here, and I hope that you enjoy the rest of your program.